Hello guys, welcome back to my channel Med Pharmaco Essentials after a long time. So in this video I have brought about the roles and responsibilities of a clinical pharmacist in an hospital setting, because all my juniors were asking like what are the roles. They were keen to know what are the roles, responsibilities, or what are the activities that we perform in the hospital. So this video can give you a brief information about what are the various roles, activities in the hospital settings. So watch the video till the end. So before we know about the roles and responsibilities, let us first know what is clinical pharmacy, who is a clinical pharmacist and all, okay? So clinical pharmacy, it is defined as an health science discipline in which the clinical pharmacist will provide the patient care that optimizes the medication therapy and promote health, wellness and disease prevention in the patient care. So we play a very important role in improving the patient therapy as well as the optimize the health of the patient. So who is a clinical pharmacist? The person who directly works with the physician or other healthcare professionals and patients to ensure that the medication prescribed for the patient is contributing to the best possible health outcome. So there are various activities that we carry on to optimize the therapy. That is to see that the best possible health outcome is reached by the therapy whatever is given to the patient. The first activity is ward round participation. So ward round participation we mainly do for identification of the medication error. That means where the choice of drug will be monitored, or correct choice of route of administration, right frequency, duration of therapy is correct or not. So all these aspects we are going to study. Next is dosage calculation and adjustment. We will check whether the doses are correct or not. It is adjusted based on whether it is a pediatric patient, geriatric patient, or it is pregnancy case, or they have any comorbid conditions. So all these things we will consider when we are attending the ward rounds. Next is assess and report ADR and side effects of the drug. So we will be monitoring the side effects or ADR of the drug for each of the drug, and we will also study the management as well as report the ADRs. Next is alternative drug therapy. See if there is drug unavailable, so what is alternative drug we can give for that. If there is resistant condition to any antibiotic, which antibiotic can be suggested. If there is comorbid condition, which drug should be given, which drug should be not given. So are the list of drug have not incompatibility, or the patient is having allergic to that drug. So all these things we will be monitoring. Next is checking for drug interactions. So any symptoms are there, then we see whether it is due to any drug interactions or what, how to manage that drug interaction. We will also look for the IV incompatibility, like the two drugs are going through IV route, so there is any incompatibility or what. So those all we think there. Next is therapeutic interventions. We will assess the things, all the patient cases, and see whether any changes can be made to optimize the patient therapy or what. So all these conditions we will be keeping in our mind when we go for ward round participation. Next role is prescription auditing. Where there is NABH accredited hospitals, there will be prescription auditing process. So there will be a checklist that we will be having with us to check for the written prescriptions. Okay, so it contains of demographic details, patient demographics, right from the date, registration number, name of the patient, gender, patient weight, everything will be considered and checked whether it is correct or not. Then we will be saying for the provisional diagnosis. We will be checking for the drug names, whether it is legible or not, whether it is written in capital letters or not, because if it is not legible properly, then there might be errors in the administration of the drug, or if it is not legible, then it is problematic in the dispensing part and all. So we will be checking for the appropriateness of prescription. It contains of generic name, what is the strength, what formulation they have used, whether the dose is correct or not, whether the frequency is correct or not, whether the formulation is having any duplication, or many drugs without indication it is given or what. So all these things we will be studying there. Next is we will check for whether there is drug interaction, drug food interaction. So all that we will be auditing in the prescription. Next, another role is antimicrobial stewardship program conduction. So we will be monitoring and assessing the use of higher end antibiotics, surgical prophylactic antibiotics, switching of antibiotics after culture and sensitivity report is done or not, assessing the proper choice of antibiotic, preventing antibiotic resistant. So all these things we will be auditing, or we will be doing our assessment based on antimicrobial use. Next, the clinical pharmacist also will present and review the relevant data as an integral member of the two committees, that is a drug and therapeutic committee as a chairperson, and in the HIC meetings also, that is hospital infection control committee meetings, they have to present all the data that they have collected, and they have to attend these meetings for better improvement of the patient care. Coming to the pharmacovigilance part, they have to report, the clinical pharmacist, whatever ADR they have got, they have to keep on reporting it to the pharmacovigilance center, or enroll that NABH accredited hospital as ADR monitoring center under the pharmacovigilance program of India. Also, they have to provide the drug informations and attend the drug related queries by the consultants or the physicians during the patient care. Pharmacist also plays a very important role in providing patient counseling, provide information about the drug or the disease, lifestyle modification. All they have to provide it to the patient. They have to provide information about the safe and effective medication management, explain the importance of medication adherence to the patient, explain the discharge medication on how and when to take the medication. So all these things will be done by a clinical pharmacist. Once appointed as a clinical pharmacist, they have to also take the training sessions. They have to conduct the classes for continuing the education program on safe medication practice in the hospitals, or based on NABH SOAPs or protocols, that is standard operating procedures. So all this will be there, and they have to provide the training regularly to other people in the hospital. One of the major role is drug dosage calculation. We have to be estimating the right dosage of the drug based on the patient physiological values and conditions, especially for the ICU patients, renal patients, pediatric patients, pregnancy condition, or hepatic patients. Next, other activities that I can describe is, first is patient medication history interview, which plays a very important role to know about which all medication the patient has been taking, or which all medication they are allergic to, so that there will be no problem of drug interaction, allergies, and all those things. Next is therapeutic drug monitoring. Monitoring the effect of each and every drug during the therapy, its effect, whether the patient has improved or not, any changes are required, alternatives are required, everything should be monitored. Next is medication error reporting. Any errors happen in the medication administration, dose or frequency, or any of the mistakes happen, that should be reported simultaneously. Medication incidents reporting, any such incidents have happened, then that also should be reported regularly. Then in case of onco hospitals, there are some oncoclinical pharmacists who mainly do the drug mixing for chemotherapy purpose. Next is participation in the clinical research activities going on in the hospitals, carry out quality improvement projects in a case of NABH accredited hospitals. So all these responsibilities are done and carried out by a clinical pharmacist in the hospitals. So you have to not only have good knowledge on the drugs, you also have to be updated with the new drugs, should be updated with the knowledge of different drugs, so that quick information can be provided for the consultants and all the things. So these were the information that I know as per my 5th year of Doctor of Pharmacy studies. So if I come to know if some other activities are there, then I will definitely let you all know. We have different kinds of activity forms that we regularly do, so that we will come across all these errors and we can report it and search alternatives for that. So please like, share the video, and subscribe the channel for more information about the clinical pharmacy.